Good morning, good night, and good evening for those who are online also. It's a pleasure for me to be here supporting this panel organized by Magen David Adom in the opening session. And we are really happy to be here and to talk about how important was the skills of innovation during COVID. Because this national society that is going to present in this moment, we're working in the COVID-19, in ambulance service, in pre-hospital care services, in disaster response. So for us, it has been really important to learn from each other how we do it, how we can do it better, and which things we implemented during COVID pandemic that we are going to keep doing after COVID. COVID gave us many lessons learned, many things we learn about this, many things that change, and we are going to remark in this panel those positive things that we already learned as national societies, and those positive things also that we learn as individuals. So I would like to thank again to Magen David Adom for this panel, for this opening session, for this moment to share, to learn, and to get better as national societies. Thank you, and thank you very much.
Thank you for joining us. Thank you so much for staying so late at night for us.
It's okay. Thank you so much, Dan. So let me start with our presentation. So I'm Darwin from Hong Kong. In this presentation, I'm going to tell you about what technology or innovations we apply on a project we deliver in COVID period, which is mainly about the elderly home relief project. So let me tell you more. So first of all, I'm going to give you some information on what happened in Hong Kong during COVID. In Hong Kong, we have about 5 waves of pandemic happened throughout the years. And in 2022, which is about the 5th wave, we have over 19 people die, and over 55% of them are patients from the elderly home and disabled home. So as you can see from the photos, you can see the elderly, the patients, they are lying on the bed outside the hospital waiting for assessment. And another angle for you to watch it clearly, you can see that this happened in most of the Hong Kong public hospital, where you can see the patients are overcrowded, and most of them are COVID patients because the public hospital having a very high pressures. So you can see patients are still waiting to be cared out there, and some of them even deceased during waiting for treatment. So it's a very sad image in there. So during this period, Hong Kong Red Cross has delivered multiple services to the people who in need. And I'm going to tell you briefly about what we've did and during that time. So the first project is about food. It's mainly because some people is being quarantined at home, and so they're unable to reach the supermarket or market to buy the food for their family. So we have some staff here in Costa. They prepare a lot of foods, and then we'll send them to their home. So doing a door-to-door delivery for those people who need. And the second service we have is hygiene packaging. So mainly we prepare some hygiene materials, for example, like masks, sanitizers, all of them, we pack them together and have them ready at our headquarters to those third line, telephone hotline on people who is like the government policy, or they even need to have some psychological support. They can call us. And we have some people talk to them and to tell them what is the update information about the COVID arrangement in Hong Kong. And the last service is about the elderly home material distribution, which is the focus I'm going to tell you about more in the next few slides. This project is mainly focusing on the people who are living in the nursing home of elderly, and I'm going to tell you more about it in the next slide. So in this elderly home project, I will tell you why we initiate this. First of all, as you can see from the photos, most of the elderly homes in Hong Kong are very overcrowded, and the quality is extremely varied. Some are very far below standards. As you can see, they're very crowded, maybe living about 50 to 60% in a small space. And the second reason is the caregiver outage. Because like when most of the elderly home, they're having a big outbreak, so the staff who are staying there are not they are not allowed to go back to their home. So they need to stay in the office throughout the day and even overtime for multiple shifts. So they ran exhausted. And the third reason why we have this project is about the overpriced item. In Hong Kong, during the fifth wave, since the logistics are being blocked, so every item in Hong Kong is being high priced, and people can't buy masks, buy test kits, and even some elderly home, they can't have this product for their residents. So due to the above three reasons, we're trying to think to create a project to help these people. So this project kicked off at the March 2022, and there are three major tasks that we're delivering. First of all, we conduct remote assessment. We try to center and ask how are they doing and what can we help. And the second part is we do some material distributions and delivery. And the final part, apart from giving them materials, we also try to deliver some education to them. For example, like telling the staff how to do infection control, and even take them to do some mask testing to ensure they have the right size mask on their mouth. So what's the pain point for this project? Since it's a very quick and responsive one. So we need IT solutions to help out to resolve that. For example, like we need a solution to receive applications, also to conduct some remote need assessments, and we also need to have a system to stock taking of these materials. So for the traditional way, it might spend a lot of time and development costs to create this system and make this happen. So we try to find some quick solutions on the internet. And then we find some local platform which we can build by ourselves, the Airtable. We just use 3 days to set it up and ready to use by our staff, which is a very great help to our service. I'm going to tell you a bit more about how we use this system for our service. So this system helps 3 things. The first of all is a one place for all applications data. And secondly, we have a very easy to use interface for our need assessment. And lastly, it can be easy to set up and we can access it in anywhere we would like to. As you can see from here, we can have one place to store all the application data. For example, we can have a gallery view of all the elderly homes in Hong Kong, and we can easily to add the data inside. The second good feature is we have a very easy to use interface where our assessor can easily input data on the online websites. We can even input how many items we deliver to the elderly home, and we can have some remarks. So this online interface can be accessed anywhere by our colleagues. When during COVID, every people is working from home, or some of them working from the warehouse. So we heavily rely on internet to collaborate on this such projects. And so this system helps us a lot to do some assessments. This project helped us through 39 homes in 39 days, and we helped out 4,105 persons or beneficiaries during this 5th wave of pandemic, which helped us a lot. And the very last page, I'll tell you some key learning of this project. So first of all, we need to think out of the box. Actually, if you're using some spreadsheets or Microsoft Word, this might help our project. But we always believe that there must be something better, a newer solutions will help us to resolve our problem. And the second key learning is don't afraid to try. Just like learning some new skills, for example, learning how to cook, learning how to drive, you might feel struggle at the beginning, but then you will treasure at the very last. We do spend a lot of time reading a lot of manual or guideline of how to build this online system by ourselves. But then we still feel without a system, the project might not success. And the last point is about innovations, not just about inventions. Though we do not have any hardware being invented throughout this project, but then we still need to have a workaround, which means is also part of innovations, new solutions for some project we used to know, which can also help us. So I hope that this can bring you some little insights of how to do some innovations on your projects. And so that's the end of my sharing. Hope this found you well.
Darwin, thank you so much for this enlightening presentation. First, I would ask the floor if there is any question or comment you would like to ask Darwin? So if none, I just, in the sake of our colleagues who don't speak English well, I would summarize very briefly in Spanish. My main message, I think, from the Hong Kong presentation is that innovation during COVID was not that much about inventing new technologies, but it was more about learning new ways of doing things using existing technology, which for me is an amazing thing. El compañero de la Cruz Roja de China, la filial de Hong Kong, compartió con nosotros el trabajo que se hizo en Cruz Roja de Hong Kong, específicamente trabajando con los hogares para los ancianos, haciendo distribución, la evaluación de las necesidades y apoyándolos psicológicamente. Y lo más importante que mencionó es que durante la pandemia ellos no desarrollaron herramientas tecnológicas nuevas, sino utilizaron plataformas tecnológicas que ya existían en el mercado, las adoptaron a la realidad necesaria en ese momento y para ellos la innovación durante la pandemia fue más que todo la utilización de plataformas que ya existían en una nueva metodología, en una nueva forma, y para ellos eso fue lo más importante en la innovación. And since I'm not going to speak the whole evening, I have the pleasure of inviting Jessica from the Global Reference Center for Disaster Preparedness, hosted by the American Red Cross.
Thank you very much, and thanks for those of you who are staying with us this evening. I really appreciate it. I'm going to sort of share a similar lesson to what we just heard from the Hong Kong folks, but one of the things that I wanted to talk about, oh, thank you. Yeah, technology. So what I wanted to talk about is really a similar lesson, as I said. One of the things that the Global Disaster Preparedness Center does, and one of the things we operate, is a website called preparecenter.org. It's designed to be a knowledge management hub for disaster preparedness practitioners, not only for Red Cross and Red Crescent national societies, but for any disaster preparedness practitioner worldwide. We have a very robust website that includes over 4,000 resources relating to disaster preparedness. So the core of what I'm going to talk about today is the Prepare Center website and how we leveraged our existing capacity and our existing technology on the Prepare Center website to provide a little bit of innovation during the COVID-19 pandemic. And this happened very, very early on. So just as the pandemic was getting started, when we didn't quite know that it was a pandemic yet, when it was mostly an epidemic for a lot of us. So early in February, March of 2020, we were contacted by the IFRC, who was recognizing that this was rapidly becoming a global problem. And the challenge that the IFRC was having is they needed to generate guidance for national societies at an extremely rapid pace. There were a lot of things that national societies needed help with. You know, this is uncharted territory. There was a lot of guidance that the health team in particular needed to provide to our national society partners, and it had to be done very quickly, and it had to be information that could be updated very rapidly. So it couldn't just be, you know, a PDF that was generated and shared as one piece of guidance and remained static. It was something that needed to be a living document. So they asked us if we could use the Prepare Center website because we sort of own this lovely little website that has a lot of flexibility. It's much, much easier to get things published on our website than it is to get things published on FedNet, and not everyone knows or has access to FedNet anyway. So it was a good opportunity for us. It started in a very analog way. We drew an idea of what we wanted to accomplish. So this is my little hand drawing, a concept of what we thought this place on our website would look like. It came to be called the COVID-19 Compendium. And the idea was that information, as I said, was being generated from all of these different teams at the IFRC, and we needed one place, just one place, where national societies could go and access all of that information. Not 10 different websites, not different newsletters, not, a bunch of different hubs, but one place. So that's what we were able to provide. So that's where the COVID-19 Resource Compendium was born. I'm going to show you just a couple of slides that sort of give you an idea of what it looks like, but it was a joint effort between the GDPC and the IFRC. They provided all of the content, and they provided someone from each one of the teams. So from the CEA team, the PGI team, the health team, all of the different teams provided a focal point for us to coordinate with, who could help to make sure that the content on the website was as up to date as possible. And what we did is provided access on the back end of our website for all of those points of contact to be able to go in and upload the most recent resources, replace old ones with new ones as rapidly as the information was changing. The other thing that we did is create some help desks. So a lot of national societies had questions that were not already being answered by the guidance being generated, so we created a sort of help desk platform so that national societies could ask questions and have them answered by members of the health team or other folks at the IFRC. That spanned a number of different topics, as you can see, from blood services to health and care, quarantine, PPE, everything that we learned about during COVID. And then we also pulled together a number of other resources. We weren't the only ones that had this idea, of course. There were other hubs that were already starting to publish content on COVID-19. We were not trying to recreate what they were doing, but we wanted to make sure that we were pointing people to those resources. So if there was another hub, like the CEA team put together a hub, we were just funneling people in that direction based on the information they were looking for. So we had the health help desks, we had links to other places where information could be found on these topics. And then for the teams at IFRC that did not have a place to publish their own content, we gave them a page. And they were able to log in, as I said, upload resources, categorize them, and keep them up to date. And each one of these pages within the compendium was complete with the most up-to-date information for national societies. So it wasn't, our website is based on WordPress. This is not a brand new technology by any means, but the way that we were able to leverage the structure of our website with being based on a resource library was something that was sort of innovative. And the speed at which we were able to do it, from the time they asked us to the time we had this site up and running, was within a week. So given the vast number of resources that were being generated, that was actually pretty quick. The other thing that we did on the Prepare Center website, which sounds a little bit more fun than just getting information, was we generated a COVID-19 kids kit. We recognized that there were a lot of students who were not going to be in school because a lot of schools were closing, and a lot of parents needed a way to help their kids understand what was going on with the pandemic. It was a very confusing time. It was difficult for parents to sort of explain why they couldn't, play with their friends, why they needed to wear masks, why they needed to wash their hands so many more times a day than they were used to. So we created a number of activities for parents to do and for kids to do to learn about different things relating to the pandemic. Everything from the proper way to wash your hands and an activity where you create your own PPE, create your own masks, to some mental health exercises to help kids manage their stress and to help them maintain their own well-being, because it was a very confusing and stressful time. So we created a whole bunch of activities and posted them again on preparecenter.org. And they broke down into all these different categories. So we had safety activities, imagination, activities where they could use their imagination, disaster preparedness games, ways that they could practice acts of kindness, because that was something that there was so much stress and so many people who were on edge, that practicing kindness was something that we really felt was an important thing to help kids continue to do instead of taking their stress out on other people, and wellness exercises. So the fun thing about the COVID-19 Kids Kit is we drew on information from a number of different national societies who were able to provide us with ideas. Every single one of them was illustrated by one of our volunteers, which was incredible. We have a volunteer graphic designer on our team, and she drew and designed every single one of these activities. And she was already on our team, and we were able to leverage her time and her talent to put this together. So again, it wasn't necessarily the most innovative in terms of technology, but what we were providing at a time of need were something that was that we got so much wonderful feedback on the COVID-19 Kids Kit that we have now since developed a teen preparedness kit, which is another activity designed for young people. So again, it was not anything that was mind-blowing or earth-shaking when it comes to the use of technology or the type of technology that we were leveraging, but we were able to do things very quickly and very creatively in a short amount of time. That's it.
Muchísimas gracias. Jessica del Centro de Referencia en Cruz Roja Americana en Desastres presentó el trabajo, cómo adoptaron el website que tiene el centro ya, usando tecnologías que ya existían, pero poniendo contenido que llegaba de diferentes departamentos de la Federación, de otras sociedades nacionales, poniendo además tienen que ayudar, help desk. How do you say in Spanish help desk? Punto de ayuda, no, punto de referencia, algo, help. Para preguntas que sociedades nacionales, filiales tenían y no había respuesta, y utilizando esto para crear todo un kit para niños de actividades que se podían hacer online en temas de seguridad, de apoyo psicosocial, de la imaginación, para ayudarle específicamente a los apoderados que tenían un problema verdadero en explicarle a sus hijos o hijas qué estaba ocurriendo y por qué su vida normal había cambiado tanto por algo que no se ve como la pandemia. Así que muchísimas gracias, Jessica. Jessica, we just need to speak to the mic, otherwise the colleagues abroad don't hear you.
For anyone who's interested in the COVID-19 Kids Kit or the Teen Prep Kit, they're available on preparecenter.org, and they're available in multiple languages. So everyone that is listening who is listening to your Spanish translations, all of that content is available for them as well.
Entonces, el contenido está disponible en preparednesscenter.org y está en diferentes idiomas, incluyendo el español, para los que les sea más fácil. Y con eso, el compañero de Costa Rica. Lo único, Michael, tienes que hacer una pausa de vez en cuando para que hagan la traducción al inglés. Sí, señor.
Buenas tardes. Bueno, me toca la oportunidad de... me toca la oportunidad de contarles la experiencia de la Cruz Roja costarricense en el trabajo en la pandemia. Y pues le hemos titulado esta ponencia en un idioma indígena de Costa Rica, del pueblo indígena Bribri, que se llama Samiñaraki, que significa caminamos juntos. Y es un poco lo que resume esta pequeña presentación de 10 minutos.
This presentation uses a term used by a native language in Costa Rica, which means we walk together.
La Cruz Roja costarricense tiene más de 100 años de servicio prehospitalario, de atención de servicio prehospitalario, y eso nos parece importante cuando pensamos en la pandemia y todo el trabajo que tenemos que desarrollar.
The Red Cross of Costa Rica has more than 100 years of ambulance services, which was a legacy which was important for the pandemic response.
Somos más de 5,000 cruzrojistas distribuidos entre voluntarios y personas remuneradas. Cerca de 1,280 son remunerados y 4,637 voluntarios.
More than 5,000 people belong to the Costa Rica Red Cross. About 1,200, 1,300 are paid staff and the others are volunteers.
La pandemia en Costa Rica lo marcó el Ministerio de Salud un 6 de marzo del año 2020 y con ello se activaron todos los mecanismos de contención del país.
March 6, 2020 was the declaration by the Costa Rica Ministry of Health of a pandemic situation and the activation of the contingency planning.
La Cruz Roja Costarricense en julio del año 2020 le reportaba a la Federación Internacional en uno de estos artículos del reporte que hacíamos como Sociedad Nacional que las principales falencias o las principales complejidades del país y que la sociedad nacional enfrentaba estaba asociado con problemas no solamente de salud, sino problemas sociales, por los temas económicos, la falta de empleo, la afectación a la parte turística por los cierres que se estaban dando de los centros de negocios y además la parte emocional, el estrés y la ansiedad.
In the report issued by July 2020 to the Secretariat, the IFRC Secretariat, Costa Rica Red Cross mentioned the social impact, the economic impact, and the impact on the well-being of the citizens.
La Cruz Roja Costarricense desarrolló sus principales acciones de campo vinculadas en tres grandes áreas. Inicialmente desde un abordaje interinstitucional, desde un abordaje intersectorial y desde la participación de la sociedad nacional.
The work was divided into cross-institutional work, cross-sectors work, and the role of the national society in the activity.
Desde el inicio nos dimos cuenta que enfrentar la pandemia claramente no podía solo el Estado, pero tampoco podía solo la sociedad nacional, sino que tenía que ser en un trabajo intersectorial, interinstitucional, y eso pues para potenciar las acciones en el campo porque los recursos siempre eran limitados.
It was clear that neither the national society nor the state can deal alone with the consequences of COVID-19 and joint ventures will be needed.
Y no queremos olvidar también que este momento también representaba, los cruzrojistas o la sociedad nacional también es parte del país y por tanto también vivían incertidumbre, miedo, preocupación.
We need to remember that the members of the Red Cross were also affected by the pandemic, not just responded to that.
Y claramente el cierre del país también afectaba, nos preocupaba la sostenibilidad de los servicios de la organización, cómo se iban a sostener esos servicios durante estos años.
And the closures and restrictions were a great threat to the business continuity of the normal activities of the national society.
Potenciamos muchísimo nuestro rol auxiliar como sociedad nacional a través de una coordinación muy cercana con el gobierno, principalmente del mecanismo de respuesta nacional o del Sistema Nacional de Gestión de Riesgo y Emergencias del país, del Estado.
The auxiliary role of the national society was paramount, and that went mainly through the channels of the cooperation on disaster preparedness and response.
Algunas de las acciones de forma muy breve que desarrollamos, bueno, como he mencionado, nuestra experiencia mayor posiblemente está en la atención prehospitalaria. Nosotros atendimos desde el año 2020 hasta el junio del 2023 incluso cerca de más de 161.416 pacientes, tomando en consideración que somos un país pequeño de 5 millones de personas, es un número bastante elevado para nosotros.
For 5 million and something inhabitants, Costa Rica Red Cross treated more than 161,000 patients from 2020 to July 2023.
También esto nos obligó a repensar nuestros procedimientos de seguridad, tanto para la atención de los pacientes como para nuestros propios cruzrojistas, y también en un contexto de presión global por el tema de los insumos, ¿verdad? Mascarillas y esto, también teníamos que potenciar nuestro rol auxiliar para poder acceder a esto y poder ayudar.
One of the greatest challenges was adapting the procedures for the safety of the patients as well as for the safety of the personnel, considering the restrictions and the unavailability of equipment, of personal protective equipment that we all faced it as a major challenge.
Lo segundo que trabajamos muy fuerte fue el fortalecimiento de las capacidades del personal, entender que en una nueva realidad teníamos que generar nuevas estrategias de formación y acompañamiento para la calidad del servicio.
There was a need to change the way we train our people and enhance their capacities and create new ways of ensuring the high level of care.
A través de la Dirección Nacional de Formación Profesional de nuestra Sociedad Nacional, la que se encarga de la parte educativa formativa, trabajamos procesos virtuales, tablas, talleres, pero también empezamos a adecuar, adaptar los cursos que eran presenciales ahora a una bimodalidad.
So online trainings were created both for ongoing training, on the job training, as well as for basic training courses.
Y otro elemento importante es la coordinación que hacemos desde los diferentes niveles, desde el nivel más comunitario o local, desde el nivel regional y desde el nivel nacional, la coordinación con lo que llamamos los comités municipales de emergencia.
There was close coordination with the local emergency committees from the community level to the national level.
Nos aseguramos la participación de la sociedad nacional en cada uno de estos espacios locales para que ejercieran ese rol auxiliar y pudieran potenciar y pudieran ser mucho más efectivos en el campo. Okay.
And of course, there was an upgrade of the capacity of the local committees to work.
Sí, también trabajamos mucho en adecuar la normativa, como el estatuto, por ejemplo, los roles de gobierno también eran importantes que siguieran funcionando y desde esta lógica pues tuvimos que adaptar la virtualidad que antes no estaba presente en nuestra realidad.
Of course, the statutes of the national societies were adapted as well.
Y de forma muy breve, también nos preocupó el tema de salud mental con 475 crurologistas y también hicimos acciones en apoyo a otras sociedades nacionales.
The topic of mental health and psychosocial support was critical, and Costa Rica Red Cross supported other national societies.
Quisiera quedarme también un poco con el trabajo de algunas de las experiencias que nosotros generamos en el campo. Por ejemplo, las filiales desarrollaron iniciativas novedosas, por ejemplo, lo que llamamos perifoneo, que es a través de las ambulancias enviar mensajes a la comunidad sobre mensajes preventivos del COVID-19.
So the chapters use their ambulances to go around the rural communities and provide messages on many things, among them on COVID-19 precautions and measures.
Y para finalizar, nada más 3 lecciones aprendidas. Uno, reconocemos el talento humano en nuestra sociedad nacional, la capacidad técnica y profesional que tenemos. El otro es que validamos la necesidad de la transformación digital. Estamos trabajando en esto, sobre todo en las zonas más rurales de la sociedad nacional.
We cherish greatly the human talent of our national society, the capacities of our staff and volunteers. Digital transformation was key, and we're working on that, especially when it comes to our more rural chapters.
También valoramos muchísimo la capacidad de creatividad y la capacidad de resiliencia de nuestros cruzrojistas, que en medio de la pandemia pudieron resistir y ser valientes. Y trabajamos muchísimo en la salud mental, que nos queda como uno de los elementos que vamos a seguir fortaleciendo, que es una de las grandes lecciones de este momento.
We recognize the resilience of our staff and volunteers who went through this pandemic with great bravery, but we still have to work on psychosocial support and mental health to support them.
Muchísimas gracias.
Muchísimas gracias, señor. And now I would like to introduce you a colleague from the Austrian Red Cross who will do his presentation online. Camilo, can you hear us?
Yes, hi, thank you very much. Can you hear me?
Yes, you just will have to do it old style, so you have to tell me next slide, and I will forward them for you.
Okay, well, thank you very much, and thank you very much for this invitation. As introduced by Jaime, my name is Camilo Palacio. I work at the Austrian Red Cross as the project manager in the Department of National Disaster Management and Research. So basically what we do is participating into different research projects, mainly in Europe in the domain of disaster management. So next slide, please. So I'm going to speak to you about a project we had in the previous 2 years. The name of the project was Pandem 2. The Pandem 2 project was a project under the framework of the Horizon 2020 program. For those of you who are not familiar with this program, basically it was a program the European Union had for funding projects in different domains. So basically what we created or participated with a consortium from different partner organizations within Europe from different areas of work. So we have research organizations, we have emergency response organizations and technology providers participating in this project with the aim to develop some IT solutions for future pandemics that will help European countries to be better prepared for pandemic and also to be used as a training tool for emergency response organizations as well as for governmental health organizations. Next slide, please. So what was important about this project? So through the recent experience we had in the COVID pandemic, we realized there is a huge gap in providing solutions for visualization from analysis of all the different data which is gathered through a pandemic from the different organizations. So the project was aiming to provide a solution mainly in the way of creating a database that helps to gather information from different as to providing some analyze and report to the different stakeholders. This project also provided some training solutions. So there is a modeling feature from the final product that could be used in training, for example, for emergency response organizations. So next slide, please. So the work of the project was based on two main areas of work. Like the first area of work was surveillance. Basically was the identification and different information which is collected from the related health agencies in a pandemic and how this information could be better analyzed in a database so that could be used for surveillance. And the second part of the work was the reporting part, so how to use the information in the database, how to analyze it, how to report, and how to share those reports with the different stakeholders, and how this information which was in the database could be visualized in the way of a dashboard. Next slide, please. So in the first area of work, the surveillance solution was called the Pandem source. So you could imagine this solution in the way of a huge database with different stakeholders having access to it and feeding this database with the information they have. So also this source is getting information from official databases or from official sources. You can think about, for example, on WHO or the ECDC or the country government organization who is dealing with the pandemic. Is taking this information, gathering this information in a huge database and analyzing the information, then providing some outputs to the related stakeholders. Next slide, please. The other part of the solution was in the way of a dashboard. So basically, through the IT solutions that were developed within the project, the dashboard took information from the Pandem source, from this database, and was able to represent or to show some visualization from the epidemiological information which was gathered through the response of this of a specific pandemic. The dashboard is also a tool that helps you to model, let's call pandemic, that you can select different diseases and you can model, so that could be used in training, for example. Next slide, please. So this is just an example about the dashboard and what kind of information is provided. So you can see, for example, there is some information which is probably familiar from the different dashboards that were developed through the COVID pandemic. You have, for example, on the left side, information about the confirmed positive cases, information about the deaths from the hospital admissions. There are also some information you could see, for example, the availability of resources you may have in hospitals and also in the first response organizations. Next slide, please. This screenshot is showing the modeling tool the dashboard includes within it. So where you see the avian influenza, it shows you that you can select different diseases. If this is the case, you could use you would like to use the dashboard for a training purpose. So you can select different diseases. You can select all the parameters for this disease, for example, the reproduction rate. You can also edit the vaccination, if the vaccination is going to be successful and what is the rate or the vaccination. And the algorithm within this modeling tool is able to analyze all this information and create, let's say, like a fake pandemic, and providing you with information that you could use for decision maker during your training. Next slide, please. So for first response organization, this is a very useful tool if you would like to prepare better for the future pandemics. So once you create and run the scenario, after providing the disease you would like to recreate and also the parameters of those disease, you came up with some information that you are seeing here in the screen. You can see, for example, the development of cases, how is the attack rate of the disease, how is the admission rate, and the deaths through your running scenario. The next slide, please. Also, you can see the information also about the resources you have available through your modeling phase. For example, this is show you how is the development of the hospital occupancy based on the information you gave to the dashboard. So the dashboard is providing you with information that could be used in real case application, let's call it in the real pandemic, but also you can recreate a pandemic if you would like to train with your organization or if you would like to run, for example, a nationwide exercise. Next slide, please. And this is also some of the advice the tool gives you based on the information you provide. For example, this is showing you that in the day 16, after you started your modeling, you are going to have, for example, a shortcoming of some resources. In this case, it's showing that you are going to have problem or not enough beds available after some days passing in your modeling. So this helps you, for example, for decision making, how you could prepare, which decisions could be done in the future so that you can prepare better your organization for this, from this pandemic, for example. The next slide, please. So what are the benefits for the first responders? So as I mentioned today, we believe it's a very innovative tool to be used as training so that you can represent or recreate different pandemic settings. If the tool is used in a real pandemic, because the tool is also able to do it, it could be used to share data within the partners. As I said before, it contains a database that is fed by different organizations so that different organizations are using the same information. It's kind of standardized information, and you can use it to exchange the data with the partners and also to monitor like real diseases, which is, for example, affecting a specific country. We already used this tool in a discussion-based exercise. The outcomes that we have from the exercise was a very easy tool to use if you don't have like a very strong IT background. And that's the end of my presentation today. Thank you very much. And I can also offer do a brief Spanish recap if you want, Jaime.
Yes, please. I will be more than happy, Camilo. Gracias.
Ok, muchísimas gracias. La presentación del día de hoy era para discutir un poco sobre un proyecto que se llama Pandem 2, un proyecto que fue financiado por la Unión Europea, que duró 2 años. El proyecto tuvo una finalización de este año y básicamente el proyecto lo que estuvo haciendo fue desarrollando un dashboard para modelar o para representar la información que se necesita en una pandemia real. Entonces, por un lado, se puede utilizar en una emergencia real porque da opciones de que diferentes organizaciones puedan alimentar o puedan proporcionar información en una base de datos, y por el otro lado esa base de datos pues representa lo que esas organizaciones han llenado en la base de datos, pero también da la opción de hacer o de recrear o hacer una simulación de lo que podría ser una emergencia real y lo que puede permitir o que se puede utilizar para entrenamientos, por ejemplo, en aquellas organizaciones que trabajan en la atención de emergencias y desastres. Muchísimas gracias.
Muchísimas gracias, Camilo. And now we will go to Magen David Adom in Israel. So, Magen David Adom, we are the Israeli National Society. As such, we are auxiliary to our authorities, and I'm mentioning here auxiliary to our authorities because that was essential during COVID-19 for Magen David Adom doing many things that are not the normal operations of us as a national society. Our main two businesses are the ambulance service. We are the national ambulance provider for the state of Israel, and the blood services. And I'm going to talk about both of them, but about many other activities that we did during the pandemic. We are an organization, we started the pandemic, by the way, about 1,500, 1,500 staff members, and we finished the pandemic doubling the number, and on top of that, we are now 3,500 staff members, and that's because of the many tasks that we had during the pandemic. We have 25,000 volunteers. Among them, we are very proud of our first response volunteers and young people who choose to do what we call national service with Magen David Adom. And we represent all the groups in our society, which is very important. And this is, I think you all saw this picture at the beginning of the pandemic of an ultra-religious Jew and a believing Muslim praying together. People don't understand why they're back to back, so I have to say it was taken in the south of Israel. So the Jew is praying towards Jerusalem, which is in the north, and the Muslim is praying towards Mecca, which is in the south. But it's a normal theme for Magen David Adom, and we are very proud. And during pandemic, this was a real strength for our national society in our capacity to outreach to different communities with different beliefs, different ideas about what is the pandemic and what is the vaccine and what are the measures, which I think were globally challenges. And the fact that we have volunteers from all the groups in our community was a real strength. And people who are used to see us in our uniforms, one day this became our new uniform, and this is what they were seeing of us. So this is what we did. And I'm talking about, of course, the transportation, the treatment transportation of patients during COVID. We collected the convalescent plasma. That at one moment, a convalescent plasma is plasma with a high level of antigens against COVID, which was believed at one point to be the most efficient treatment for COVID patients. Unfortunately, it wasn't. Kind of things that you try and you fail. We devoted a lot of time on public education, and I want to point out this, because people are not aware of a very specific challenge, which is celebrating Ramadan 3 times during the pandemic. In Ramadan, Muslim people fast during the day, but the most important thing of the day for them is the iftar, the dinner, the family dinner at the end of the fasting. But it's not my family, 4 people. It's a family dinner, 40 people, 50 people. And we had to talk with those communities and speak about why it is a tradition, but at the moment it is not a wise tradition, and you don't want to expose your elderly aunt and your grandmother and your grandfather to 50 people every day for a month, because the chances they will get COVID is very high. So that was for us a priority, talking with communities, and in this case, regulations are not good. You need to convince people. And the only way to convince people is through our volunteers. And one of the best projects I'm very proud of is one of our community volunteers sent our youth volunteers to speak with their grandparents. And suddenly the 17 years old boy or girl became the most knowledgeable person in the family about COVID. And he was talking to the whole family about COVID. And it was very successful. I'm going to talk about the call center. And this is my Director General answering the phones, just to give an idea. On an average day, Magen David Adom call centers reply to roughly 6,000 calls. 22 of March 2020, we answered 81,000 calls in one day. Everyone was, I hate this word, but that's the only one, panicking, not knowing what's going on, and trying to get some kind of information, calling us. And all of us were picking up the phone and giving answers. And you can see it's merged because we didn't have masks yet. We did testing, PCR and antigen, and we vaccinated people. And we vaccinated not because it's the normal thing. Emergency medical technicians in Israel don't vaccinate people, but we had no nurses, and we had to vaccinate the population. And our EMTs managed to vaccinate all the elderly population in Israel within 42 days. 21 days first shot, 21 days the second shot, and this is how we broke the fourth wave, the Delta wave that was killing people. But it was thanks to not our innovation, our government innovation that said, okay, you are professionals, you can do that. And by the way, by saying professionals, I'm talking about our staff and volunteers. I just want to show you a video we did a year and a half into the pandemic to recognize the work of our volunteers and our staff. Control room, can you please play the video for me? So I want to talk about remote testing. And remote testing is a need, I have to say, came out of stupidity. I'm talking 2 years into the pandemic. We already had antigen tests and people were testing themselves at home. And then our health authorities come with a nice idea. Don't quote me on this. You are feeling sick. You test yourself at home and you are positive. But you need to get a medical permit to stay at home for a week. And you want to be registered in the database, in the health database, as a recovering person from COVID. They required what was called an institutional test. What does it mean in practical terms, especially for the more vulnerable people? You are sick. You are officially sick because you tested positive. You will take public transportation, infect everyone on the bus, go to the testing center, queue there, infect everyone on the queue. You will get tested. Surprisingly, you will come out positive. But now it's institutional. You are in the system. So you will be told to go home on public transportation, infect everyone on the bus, stay at home for 7 days and you are okay. We all understand that it doesn't make sense. So we created a system were using basically Zoom. People could make their antigen test at home. We supervised the test to make sure that they are not faking positive or negative tests. We provided the information into the system, and that's it. And it was something that really helped people who are sick. They don't want to go out of their homes. They are responsible people. They don't want to infect others. So it was a great, simple solution that worked. What have we learned? Technology is essential, but we need the people. First of all, the most important thing, we can have the best solutions, and we have a great IT department, and it's here somewhere. But we need to remember that not everyone is literate in the use of technology, and our people who are doing the remote testing can tell you, we thought that after 2 years of pandemic, every grandmother in Israel is capable of doing a video conference. It came out that it is not the case. So we still have communities. We are talking about campaigns over social media. We are talking about the networks. It's good for 80% of the population. We still have 20% of the population that for many reasons don't have the access to the technology. Our youth volunteers, you can see them there in the call center. And after that horrible day of 80,000 calls, we put them as our COVID frequently asked questions center. Our professional call takers, we triage if the call is an emergency or need for information, and if it is need for information, it would go to the volunteers to answer. And every day we provided them with a briefing and a list of frequently asked questions. I thought it's going to be a disaster. I said 17 years old don't have the patience to answer elderly people who are asking the same question 4 times. I was wrong. I have to admit it. I hate telling people I was wrong. I was really wrong. They were extremely patient and understanding and repeating and looking for someone who speaks Amharic and someone who speaks Russian and someone who speaks, I don't know, French. So they can explain. And for me, the most amazing thing, and I listened to one call, a lady reading the text on a screen of a computer because she was using exactly what it's on the official website of the Ministry of Health. An elderly lady, I think she was 80-something. What she really wanted is a human being to tell her that what she is reading is right. It was just that. It's a human need. People read on a screen, they want a human being to talk to them. And this is something that we had to address. National societies are a huge asset to the national healthcare system. And many national societies manage to get that recognition by their systems. This is something that we should work upon in the next years. Our IT capacities in-house were essential, and we had to change SOPs, and it was crucial for us. So, thank you very much. Y en resumen cortito, Magen David Adom, que es el Sistema Nacional de Ambulancias, además hizo los exámenes de PCR y de antigen y vacunó a las personas. Nuestras capacidades en desarrollar tecnologías en casa y la utilización de nuestros voluntarios fue esencial para nuestra respuesta. And the last presentation, I am privileged and honored to invite our host. Peter, please.
Thank you very much, Megan. My name is Peter Mwangi. I work for Emergency Plus Medical Services. E-Plus is fully owned by Kenya Red Cross Society. We run a fleet of ambulance services across the country. We have the largest fleet in East and Central Africa. So our day-to-day activities is response to houses, response to emergencies. There are different emergencies that we responded, but for this particular session, I'm going to share what went through during COVID session. So allow me to move to the first slide. As you can see from that first slide there, this is one of our team who are on PPE that I used to present ourselves during emergency situation. And we learned a lot when we heard about COVID. I remember first instance when we heard that there is COVID in the Western world, everybody was scared here. We used to receive videos circulating in social media. You see, then we used to wonder, if this COVID comes here, what are we going to do? And we are being the first line care providers in the country, we had to keep on thinking, if this thing comes here, how are we going to respond? I remember the first case that we handled was a dispatch. So we received a call regarding a patient who was in the house. And so when we heard about the symptoms, we knew this one is COVID. So COVID is here. And we need to pick them to evacuate them to hospital. And now again, we need to allocate a team to go and do that evacuation to hospital. So it was a bit challenging to make that decision. But I thank God because we had some, as you are going to see through the slide, we had acquired enough PPEs that we had done some initial training for our team. We responded to the emergencies that we proceeded. Let me go straight to the next slide. This I've just mentioned that. We are flown by Kenya Red Cross. Let me move to the next one. So during the pandemic, we faced some challenges that required innovative solutions. I would like to mention two categories of lessons that we learned through this session. So first session, we came up with, as a society, ensuring safety, staff safety and infection control. This was key, considering that we are expected to respond to emergencies nationwide if they come. And in this country, I would like to say our brand is very much respected. When we have national disasters, we are always there. That is our tagline. We are always there. So we are expected to respond and assist because our mission is to save life at all times. So the danger of contracting the virus increased while emergency care was being provided by our E+ crew. So it became crucially important to ensure the safety of our staff by putting in place efficient infection control procedures. So what we did, sorry? Let me, several cutting-edge solutions were created to deal with the risk of contracting the virus by our staff. So we converted our ambulances to, this is what we call a negative pressure by use of a portable isolation chamber. We have the largest number of portable isolation chamber, which is they are still in place. We have a number of 7. So in East and Central Africa, in the first, if I go back to the first slide, you can see in the photo there, they've just cleared, this is a sample of the isolation chamber. What happened is you use negative pressure where you don't come, when you're transporting the patient, you are not in contact with the patient directly. you're able to assist the patient on the stretcher who is in the chamber. This one you can do it either in aircraft, air evacuation, and even in the ground air ambulance, in the ground ambulance. So this is one of the gadgets that we improvised, which has come in handy to date. Those who will happen to visit our office on the other end, they might have seen the chamber and how it works. So that's about the isolation chamber. So that's one of the other thing that we introduced, the specific PPEs, the N95 mask for our team, and which also came in handy. We move to the next slide. Sorry. So the main lesson observed from this innovation is the importance of prioritizing staff safety and control measures by, that one we mentioned, sorry for that. The long-term impact lessons from this is actually staff safety control as ambulance service providers during the COVID-19 pandemic are significant. And here are some of the long-term impacts that we came across. So the ambulance service providers now, they have a better understanding of the significance of being ready for infectious disease outbreaks and other public health emergencies. So future crises will be better prepared. As I said, we still have those isolation chamber, and we still use them even to date. In the long run, service providers are likely to strengthen their protocols, gather essential supplies, and set up a reliable procedure. Enhanced staff safety, the pandemic lessons will help ambulance service providers make long improvements to their personnel safety. This to reduce the risk of exposure to infections, and more so through use of enhanced PPEs. There are training programs which are usually ongoing CMEs. We've been doing them every now and then. This will guarantee the security and well-being of ambulance staff long beyond the pandemic initial outbreak. So the third point here is strengthened infection control procedures. Ambulance service providers now have a better understanding of infection control procedures that are applicable outside of the COVID-19 pandemic's particular context. So these insights will contribute to continued improvements in infection control methods and practices, ensuring that ambulance crew have the skills and resources required to reduce the spread of infectious diseases during routine practices, operations. So collaboration and partnership are crucial between ambulance service providers, public health organizations, that is like the Ministry of Health, United Nations, and other healthcare stakeholders, as the epidemic has shown. So stronger linkages and improved communication channel between these groups have resulted from the lessons learned in assuring employee safety and infection control. So this cooperative strategy will probably persist throughout time, allowing for effective information exchange, coordinated response actions, and the applications of best practices to safeguard personal and patients during infectious disease outbreaks. So another long-term effect in terms of infection control, cultural change in favor of the safety. Ambulance service providers have undergone a cultural change as a result of lessons learned in assuring personnel safety and infection control. Safety for both the employees and patients is now more widely recognized and prioritized. This cultural change will continue to result in continued investments in safety precautions, ongoing training, instructions on infection control procedures, and a proactive strategy to reduce risk and long-term safeguard well-being of staff, our ambulance staff. Now, number 2, 3 minutes, okay. Mental health and well-being. This is another aspect that we looked at critically with our staff. And the pandemic placed immense physical, psychological strain on ambulance personnel, leading to increased stress, burnout, and mental health challenges. So it became crucial to address the well-being of our ambulance crew and provide support during these challenging times. So some of the innovations developed. We worked with partners with psychosocial programs. With our mother brand, we encourage counseling services for our staff. The main lesson observed from this innovation is the recognition of the importance of addressing mental health. Mental health was critical with the issue of the stigmatization. So it came in handy, and the impact of these innovations came in two folds. It enhanced the well-being and the job satisfaction of our ambulance crew, thus leading to better retention rates and quality of care. And it promoted a cultural support and compassion within the organization. Taking care of mental well-being for our ambulance crew is crucial not only during the pandemic, but also in the long term. Let me go to some of the innovations that are engineered toward this. To assist two major Kenyans, some of the innovation we did, we worked with the Lancet and the Camry. We trained our staff to do nasal swabs. So we worked hand in hand with the Lancet and Camry majorly with assisting in taking samples from various patients across the country. So other activity that we did due to our large fleet of the ambulances, we partnered with the Ministry of Health to conduct training of suspected and confirmed COVID tracing of cases. So we worked hard in hand with the Ministry of Health and other isolation institutions, private institutions. Then we also introduced telemedicine, telehealth that came up. We didn't have that one before COVID, where you could seek doctor's advice online, and you are advised what to do. The demand for safety screening in public areas, again, we worked with in public areas in terms of decontamination services for private and public facilities. So you all know a fogging machine that we introduced. We used that one to visit patients who have been affected and are in home care to try to decongest our hospitals. So we visit the homes and do decontamination and fumigation, basically with a fogger. Yeah. And number 5, knowledge of dissemination for our partners and clients through webinars, in-house trainings, aided in reducing the stigma around the COVID-19 and acceptance of those affected. So we also aided in setting up recovery groups, a team set up to walk through those confirmed and on home-based care who needed support, thus reduce on their loneliness associated with their dealing with the disease. So in summary, innovation solutions during the COVID-19 pandemic have addressed critical issues faced by E-Plus ambulance services. The utilization of portable isolation chamber within our ambulances, as well as improving PPE to ensure staff safety and infection control, educating the masses on the IPC standards, aided reduce stigma, contact tracing, building the brand, and ensuring mental well-being of our staff has gone a long way to impact our services. So the main lesson observed include the significance of staff safety, infection control, and efficient mental wellness to all staff offering emergency care. So these innovations have a lasting impact on E-Plus as an ambulance service provider, fostering a faster working environment, improved patient care, and nurturing a supportive work environment. Yeah. Thank you.
Thank you very much, Peter. Un resumen cortito para nuestros compañeros, I'll do it second Spanish, que están en los países de habla España, el servicio de ambulancias de Cruz Roja de Kenia, and please provide us your feedback in the meantime. Trabajó con cámaras de aislamiento, proyectos de desinfectación en los domicilios de personas que estaban hospitalizadas en casa y la educación del público frente al COVID. So I would like to thank you for your participation and patience. Thank you so much for those in the room, for those online. Hope the lessons learned first will be implemented, and secondly, we will not be